The honourable member for Cape Breton Centre.
Mr. Speaker, a few months ago I brought up the suspension of the Waterford Consolidated Hospital mobile care team. I was worried about health care in industrial Cape Breton, worried that our community hospitals were having their oxygen supply cut off. Clearly, residents of Glace Bay and North Sydney were experiencing similar problems. At the time, we were told we were fear-mongering, but it seems with the news of the potential closure of the Northside General and Glace Bay Hospital, I wasn't too far from the truth. Mr. Speaker, will the Minister of Health admit that closing community hospitals in the CBRM was the plan all along?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I'm not sure where the member's getting the information she's cited in the question there before, Mr. Speaker, particularly with respect to references of closures of facilities. So it's difficult, Mr. Speaker, to respond to the inquiry based upon information that I don't have before me.
The honourable member for Cape Breton Centre.
Thank you, Mr. Speaker. Actually, to the Minister of Health's question, it's actually something that's being done, from what we understand, without the NSHA involved, being done at the doctor level, and that's who is telling us. So, Mr. Speaker, when we asked about this yesterday, the Minister said that the reviews of community hospitals should be expected and that the Health Authority is always working to deliver care in the most effective way. Mr. Speaker, would the Health Minister table a list of hospitals under review in Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. Indeed, Mr. Speaker, part of the role and the responsibility of the Nova Scotia Health Authority is to review all health services to ensure that we're operating and providing the care and the services that Nova Scotians need. Mr. Speaker, we're seeing significant progress taking place. We're seeing investments based upon a proposal brought forward by the Nova Scotia Health Authority, which they developed in partnership with orthopedic surgeons, which is moving us towards the national benchmark, Mr. Speaker. We've seen partnerships and working with physicians, Mr. Speaker, and doctors in Nova Scotia to enhance our ability to compensate frontline family care providers. Mr. Speaker, we work with our physicians all the time with primary care access through collaborative practices. Mr. Speaker, that's what happens in our healthcare system. It's the way to move forward and to provide the best care possible to all Nova Scotians.